COVID-19 shot, or testing. Dr. Raul Pino is here. He'll take a deeper dive into the numbers and talk about testing at Orlando International Airport. Joining us from the 9th Judicial Circuit Court is Chief Judge Donald Myers, who will discuss what residents can expect for in-person proceedings that will start happening next week. And finally, Orange County's Emergency Manager, Chief Laura Lee Avery, will be here to talk about the start of the Atlantic hurricane season. Mayor?
All right, thank you, Jane Wattrell. Good afternoon to all of you. Welcome to our 137th press briefing. A lot has happened in the last year or so. And so far it's been a busy June for all of us as well. We see our weather phenomena going on. Today it's been raining. Thank you for making it through the rain. But also, we'll talk a little bit about the upcoming months. Of course, for the last 4 or 5 days, it's been very rainy, but we're within the Atlantic hurricane season. We've asked Chief Avery to come today, and she's going to talk to you a little bit about some of our hurricane preparedness. Forecasters are predicting another active season with 13 to 20 named storms, of which 3 to 5 of them could become major hurricanes, which means that they will be a Category 3 or higher. Let's pray that they not come anywhere close to us. Fortunately, 2021 won't be like last year's hurricane season, which was a record-breaking year with 30 named tropical storms. And in just a few moments, when Chief Avery comes up, she'll fill in the gaps. We continue to do exceedingly well when it comes to containing the coronavirus. For the past 25 days, our 14-day rolling positivity rate has remained below 5%. Today, our rolling positivity rate is a low 3.7%, which is really just great news, I think, for our community as we continue to recover. Our COVID-19 vaccination numbers continue to increase. The Florida Department of Health in Orange County reports that 55.44% of county residents 12 years of age and older have had at least one dose of the vaccine. Dr. Pino tells me that our true percentage of the population having received at least one dose of the vaccine is likely 7 to 8 points higher due to inoculations done by the Veterans Administration of the VA hospital and clinic here within the area. Since the start of the pandemic, the numbers are 142,440 Orange County residents have tested positive for the coronavirus. Sadly, 1,327 residents have lost their lives. The New York Times reported today that COVID-19 has claimed more than 1,000 lives in the United States, and Florida has seen over 37,000 deaths from the virus. So it is truly a serious virus that we have contended with now for months. Barnett Park continues to offer free drive-through COVID-19 vaccinations and testing 7 days a week between the hours of 9 a.m. and 5 p.m., 9 a.m. and 5 p.m. If you want to be vaccinated, you can choose between the Pfizer brand or the one-dose Johnson & Johnson vaccine. Orange County vaccinates about 300 people a day at Barnett Park. We also offer testing for the coronavirus. Individuals can select either the molecular PCR or the rapid antigen testing. For the past week, our health services team is testing an average of over 800 individuals each day. For more information on testing, vaccinations at Barnett, you can go to ocfl.net/testing. The I Got My Shot vaccine trailer is still moving around Orange County offering free coronavirus shots to any resident, including those who are homebound or hard to reach individuals. On Friday afternoon of this week, the mobile trailer will be in the Hunters Creek area at Sabora's Bakery on South Orange Blossom Trail between the hours of 2 p.m. and 6 p.m. On Saturday, the trailer will be in the city of Orlando at Barker Park, which is in the Tampa Tampa Boulevard, Citrus Bowl, Camping World Stadium area, which is off of the Monte Carlo Trail area. The trailer would be at Barker Park between the hours of 10 a.m. and 2 p.m., not Barnett, but Barker Park. A total of 5 staff members made up of nurses, EMTs, and clerks will be operating the mobile trailer. Again, the I Got My Shot trailer can vaccinate more than 300 of our residents each day. And now let me talk a little bit about a community service organization, the Links Group. Starting Saturday morning, June the 19th, there will be free COVID-19 vaccinations at the Jacqueline Bradley and Clarence Otis Boys and Girls Club off of Lakeland Avenue. Again, this area is near Camping World Stadium. The event is called Communiversity Vaccination Strong. They will feature free food, gift cards, and other giveaways while supplies last. It is also part of a celebration of the Juneteenth holiday. The event will run between the hours of 9 a.m. until 3 p.m. The primary sponsor, again, is the Orlando chapter of the Links, L-I-N-K-S, one of the oldest and largest women's volunteer service organizations in the United States. And now I think the next item I'm going to talk about is worthy of news about an environmentally sensitive issue. Friday, I hope everyone will tune in to Orange TV and watch the groundbreaking ceremony for the start of a major septic to sewer conversion project in the Wekiva Springs area. Over the next 15 years, more than 2,000 homes in our Orange County Commissioner Christine Moore's district will be connected to the county's central sewer system. The project will help preserve our natural resources like the Wekiva River and Wekiva Springs, which are affected by fertilizer and septic tanks. The ceremony will be held at 11:30 on Friday morning, and we hope you're able to catch it, those of you in the media. And I'm going to turn it over to Dr. Pino from the Department of Health at this point, and he'll be followed by Chief Judge Myers and then Division Chief Avery from Emergency Management. Okay.
Thank you, Mayor. Good afternoon, everyone. The county really could not be in a better position. We are at our lowest rate of hospitalizations in September last year. We have the lowest rate of teens, of 15 to 17 years old with infection, and that's an important piece. Before school start, this is where we are, at our lowest rate of infection between 5 to 17 years old. So take a pause on that moment. And how can we keep that rate in that age as low as it is right now? It is by vaccinating our children who are eligible for vaccines, those who are 12 to 17 years old that need parental consent to be able to be vaccinated. It is important to vaccinate these children. School will start at the end of July. That's another congregated setting. We know more students are going to be incorporated into physical presence at the school, increasing density of individuals in crowded spaces. And we know what that can do to COVID-19. And the fact that new variants continue to develop, and we have heard the news about the Delta variant that seems to be even more aggressive than all the variants before, and it seems to be affecting younger more than before. And we haven't detected the variant in our county yet, but that doesn't mean that it will not be here in 2 weeks, 3 weeks, or even next week. So it is important. This is a time to vaccinate your child before school starts. And we are hoping that during this school year, we also will be able to vaccinate even younger than 12. But as a parent, your consent is needed. Your consent is needed to be able to vaccinate your child. We are providing, together with the school system and contractors, by singing the schools. We have more than 100 locations in our county that are offering school vaccinations. The emergency, the centers are offering vaccinations. We have the mobile unit every Wednesday for sure at Aola Park offering vaccinations. We're also offering vaccinations at the airport. There is plenty of vaccine. This is the time to take it. It takes about 2 weeks from the second dose if you take two, which is the case for the children, and 2 weeks from you take your Johnson & Johnson for those who are 18 and older to be fully immunized. And that's the way to protect your child, your niece, your nephew, everyone who goes to school, and the teachers as well. So the numbers, the mayor mentioned to you, our residents' cumulative cases is up to 142,440. Our recovery rate continued to be of 98, and our daily cases are being in the last few days below 100. So that's important. Our 14-day, the mayor mentioned to you, is at 3.7. This is the lowest there has been. And with regard to death, we are at 1,327. Those additional 7 deaths, the age range was 59 to 85 with a median of 73. And there were 4 female, 3 male, 1 Asian, 6 white, 2 Hispanics, 5 non-Hispanics. One of the deaths was from January of this year, 4 were from May, and only 2 are from June. So we see that it continues to reduce the rate. For immunizations, let me be a little bit more specific on this one than other days. The total number of doses administered in our county is up to 1,248,537. Now, what is happening now is more of the vaccines that we are giving are second doses and not first dose. So yesterday, for example, over 3,000 doses were reported to the state, 3,144. Out of those, over 2,000 were second dose. So we are now giving more second dose than first dose. That's why our percentage is now very slowly going up, at least 1 dose, which is over 50% right now, but it continues to go very slow. And that's what important this age group. Why this age group is important? Because people who are 65 years and older in our county, fully vaccinated, is at 78%. And that is a significant number. And residents 65 years and older with only 1 dose is 86% of our county. People who are 65 years or older have at least 1 dose. For the general numbers that we are following, eligible residents that are completed at least 1 dose, those are 675,447, and that is putting us at 55.44%. Now, we have come a long way. Remember, the orange has this little juice when we started following the orange, and now we are over the half. So it is for residents 12 to 17, to give you an idea of where our concern is coming from. Our residents 12 to 17, we have only vaccinated with at least 1 dose, 31,247. That is only 29% of that population, and that needs to increase rapidly before we go into the school year. I mentioned a little note about the variants. I know people are very interested in the Delta variant. We have not detected here. Some areas are also doing studies on sewage and try to detect variants in the sewage. Sometimes you can detect it in the sewage before you can even detect it in humans. And so we are alert and watching on that, but we haven't seen anything. With the breakthrough cases, we have been able to calculate some, and for Moderna, that number is 45 cases, but it's only 0.031% of the individuals that were vaccinated with Moderna. For Pfizer, that number is at 0.05, so this is how low these breakthrough cases are. For Johnson & Johnson, is 0.1, and unknown cases, we are at 0.5. Another important information for you and for the community is that June 27th is HIV testing date. And of course, the county and the health department are going to be involved in several testing activities. We are going to have that in our website, and also we will send it through our different social media. But important for you to know is that we continue to offer HIV testing confidentially at home. You can request, and we will mail it to you. You can request an HIV test. It comes with instructions, how you can take the test, what the results can be, who to call, depending on what the results are, and we can even be on the phone with you if it's during working hours that you take that test to guide you through the process if needed. So please take advantage of that. You can order your test at Talk Test CFL, like Talk Test Central Florida, talktestcfl.com. You can order your confidential test, and we will provide it to you by mail. It has been interesting questions about international visitors and vaccination at the airports. The state is finishing that contract by the 18th of this month, and we are planning to continue that through some different venue. It could be us, it could be a contractor. We have not made that determination yet, but the determination has been made that we will continue offering those services, personnel and resources allowing. It has picked up in steam. They started with 60 a day, now they are going 300, 400 a day. I don't have the final numbers with me because I haven't been able to desegregate the data, which we are planning to do soon. But it is important that this is meant for our residents, although there are no restrictions beside age, but it's actually meant to capture residents who are coming from outside our county to get vaccinated before they get here. And for those who are using the services at the airport, my advice is please use Johnson & Johnson. It's offered there. It's only one dose, and you will not have to deal with finding a second dose, and we have plenty of it. And it has been extended the expiration date for a few more months so that we can provide those services. With that, I will pass it to Chief Judge Myers and take any questions from you after this session.
Thank you, Dr. Pino, and good afternoon, everybody. And on behalf of the 66 judges, soon to be 69, with our success in the legislature this year, judges in the Ninth Circuit and our court staff, I want to say thank you so much for your cooperation and your assistance in communicating with the community about the things that are ongoing in the court system. What we do impacts so many people. And I want to reassure you that as we talk about a transition plan out of the pandemic and restoring full access to the courthouse, that the health and safety of all of our Ninth Circuit court users and our staff will continue to be our priority as we expand that access to the courts. Following increased levels of vaccination throughout the state and the safety recommendations by the CDC, this past week, the Florida Supreme Court issued a new administrative order that fine-tunes a plan for full restoration of access to the court operations. Our circuit will issue a companion order this week that will outline some very specific changes to the operations. Those changes are going to take effect on Monday, June the 21st. They will include, number one, to increase the workflow and to expand the space that's available inside of the courthouse for in-person proceedings and trials. We will continue to do much work virtually, remotely, so that we free up space inside the courthouse for those proceedings that need to be held in person. People who are attending in-person proceedings in the courthouse will no longer be required to wear a mask. They also will not be required to socially distance any longer. The only exception to that will be proceedings that are taking place at the Booking and Release Center at the jail. The current CDC recommendations continue to be that you wear masks inside of correctional facilities. So our courtrooms inside the correctional facilities will still be masked and socially distanced. We have been back in the courthouse trying cases since last October. We've done so safely. We have not had any known cases of the transmission of virus or brought the virus into the courthouse to our knowledge. But to expedite many of those cases that have been building in this backlog time, We're going to be bringing in additional jurors now on a weekly basis. We've been shooting for about 100 jurors per day. That number is going to double effective the first week of July. So you'll see increased jury summonses going out. We're looking for increased jurors coming into the courthouse. We'll gradually begin to ramp that number up to meet the needs of the cases that need to be tried inside the courthouse. Jurors may continue to wear masks if they wish. Anybody who comes in the courthouse can continue to wear a mask if they wish. We will provide and continue to provide masks for folks who are coming into the courthouse that wish to wear one. Anyone, however, who is continuing to experience or experiencing for the first time any symptoms that would be flu-like or COVID-like, we're asking not to enter the courthouse, obviously. And so if you have been summoned as a juror and you're experiencing symptoms, please contact our jury systems. They will provide an excuse for you for this time around, and we'll catch up with you next year for your jury service. We are so glad to be nearing the final phase of the pandemic and expanding access to the court system. If you've got questions or you're looking for ongoing updates, I just want you to visit the circuit's website at ninthcircuit.org or follow us on Facebook or Twitter at Ninth Circuit FL. We will continue to post updates in connection with our court operations there. Thanks so much for the chance to be with you. I invite Chief Avery with Emergency Management.
So they saved the best for last, and I'll just say that because I'm not going to talk about COVID. But, so I just want to take a moment, as Judge Myers did, to thank everyone, especially our mayor and all of the staff and partners, including all of the news media that has worked tirelessly through the past several months. This has not been an easy, I could say year, but it's been longer than that. But under the great leadership of our Orange County team and the unwavering support from all of our citizens, we have come through this together, and we are stronger. Through the past several months, we have not only been focused on our COVID-19 response, but have also been ensuring that final preparations are in place for what is expected to be another active hurricane season. Last year, as the mayor mentioned, was a record-breaking year that had 30 named storms, breaking a previous record of 27 storms. This year, again, the predictions are for 13 to 20 named storms and 6 to 10 hurricanes, with 3 to 5 of them becoming major hurricanes. So on behalf of Emergency Management, here in Orange County, I must take this opportunity to remind you to remain prepared. Have a plan. In making your plan, consider loved ones with special needs. Orange County has resources to assist, and we recommend that people register well in advance of a storm by calling 311. Make sure your disaster kit is ready, and this should include at least 5 to 7 days of food and water, and also medication for people, babies, and don't forget your pets. And when we talk about pets, in COVID-19, we had a large number of people adopt pets. So we would expect to have more pets in our shelter. So don't forget their needs, their basic needs, and also their medications that your pets might need. We want you to make sure you have flashlights and batteries and all important home insurance papers, any of the insurance information that you have, any of that stuff. Make sure that you're looking over that now to make sure it's all in good order. You don't want to wait for a storm to be pulling that information out. You want to make sure you have a battery-operated radio. I know Hurricane Charlie, it was my saving grace. I was actually at home for that storm because we didn't expect it to impact us. And that's the only way that I had any connection to radio because TVs and power was off. So you want to make sure that you have a weather radio and a first aid kit. And also, please make sure that you have cash on hand prior to the storm. So if you have a little bit of cash, Put it somewhere for a rainy day, and that way if the ATMs are not working, you will have cash on hand. We want to make sure that you remember that prior to the storm, you can turn on the tap water, and you can save that water in clean storage containers. So it's one of the first things we see in the stores fly off the shelves is that bottled water. So you can certainly, prior to a storm, fill up those clean jugs, put them in the refrigerator. You could be doing that now. And that way you don't have to worry about having enough water for your family and loved ones upon a storm. Make sure to walk the outside of your property to verify that there are no loose objects. Those tend to project with the elevated winds. And if you have a generator, please, we cannot stress this enough, please only test and use that generator outside at least 10 feet from a window or a door, and never, never, never refuel that generator while it is running. It seems like every year, someone experiences carbon monoxide poisoning. Carbon monoxide is deadly. This gas is colorless and odorless, and even if you can't smell the fumes, you may have been exposed. Please continue to monitor your local news outlets, but also Orange County's social media for the latest updates, which can also be found at ocfl.net/storm. You can also get up-to-the-minute information about storms and other emergencies by signing up for text and email alerts at ocalert.net or by downloading the free OCFL Alert app from the Google or Apple Store. Just remember, preparing today is tomorrow's success. Mayor?
All right. Thank you to Division Chief Avery from Orange County Fire Rescue and our Office of Emergency Management. They do a fantastic job there. She gave wonderful safety tips. Hopefully our viewing and listening audience will take heed to the recommendations that she's made. If there's any Spanish-speaking media here, we have Ms. Ilia Torres, who has joined us, who will help with the translation. And I also do see Commissioner Gomez Cordero, who has joined us. She can help with translation also, and Dr. Pino is fluent. And then we have from Orange County Public Schools, Mr. Scott Howard has joined us. So if you have any questions for the school district, Chief Judge Myers or Division Chief Avery or Dr. Pino, we'll open it up for questions at this time.
Even that I talked to her before I came in.
This part's on camera, though. A lot of folks have questions about the Delta variant. I know you mentioned it a little bit and that we haven't seen any here yet, but there are some concerns that because we're not seeing the daily numbers as we used to, that the Delta variant could come in and increase the numbers here, and folks might not know about it in a timely fashion. What can you tell them about how that's being monitored and what ways that might be put out?
So we continue to monitor the numbers daily. We have the capability in-house to do analytics at the same level that the state does. We are very fortunate to have that. So it will not, if the variant is reported, it will not be 24 hours before we will know about it. It will be immediate as soon as it gets reported. So on that, people can be trusted that that information we share, if it happens, the same way that we continue to share information. And the data, although the pandemic has slowed down significantly for us, we continue to monitor the data the same way. We have not changed those processes yet. We look at it daily. We have an analytics person just dedicated to the pandemic itself, and we have an analytic person just dedicated to immunizations. We continue to do that, the same levels that we were before. What it also allow us, this space and this breathing room, is also to clean up the data so that we can do very analytics as we move forward. So part of the process that the core team is engaged, as now that we are not tracing that many individuals, is also cleaning that data, putting into perspective, being able to fix ages and discordances that we have found through the data.
Dr. Pino, Emily Braun with News 13. You mentioned that only 29% of the population of those aged 12 to 17 have received at least one dose of the vaccine. You want to see that number go way up, and I know the obvious answer to this question is as high as possible, but realistically, what would you like to see that percentage get to before the school year
At
starts?
least to pass the 50%, at least to do that. Because when you get to 50%, it's a little bit more difficult for any infection to move into a population. It kind of slow it down. Of course, the higher you go, the better the chances are that you're going to stop it. As I explained before, when you get immunity of the people that surround you, when someone with infection comes into that group, if everyone is vaccinated, it's totally blocked. If you are 50% vaccinated in that segment of the population, there is 50% chances that it will get transmitted to another individual. But the more people are vaccinated, even if it jumps one node, even if it jumps into that person, because number of people are vaccinated, it will not transmit to the speed that normally will do. And that will also give us time to do trace investigation, to contact tracing, to alert individual, to place individual in isolation. So vaccination is not only regarding to the individual, but also us as a system. How can we better protect the community? And how can we better use our resources? And again, the more people are vaccinated, the better for individual, the better for the community, the better for the resources that we are burning through this pandemic.
Melissa Thomas with Florida National News. This question is for Mayor Demings. Just to kind of piggyback off of what Dr. Pino said, that percentage he shared, is that your kind of marker for when these particular briefings would come to an end, especially now that the requirements for the county have been kind of eased?
Well, I don't know when it will precisely come to an end, but I do believe that each day as we vaccinate more people, we get closer to that point where we won't see the virus spreading within our community. And I point us back to the goal was to get up to the 79% range. We were optimistic and remain optimistic that by July the 4th, America will be at the 70% threshold, and perhaps we will make it here within Orange County. I did have a conversation earlier today with Dr. Pino. It's going to be a significant challenge for us here in Orange County to reach 70% by July the 4th without increasing, I think, the rate of vaccinations within our community significantly. Between now and then, it's going to be a challenge. But we have the opportunity to do so. So this weekend, for example, since we will be observing a significant historical point in our community, Juneteenth, Freedom Day, Emancipation Day, we have a number of initiatives that we're doing out in the community in some of the underserved areas, and we are optimistic that by doing so, we will increase the rate of vaccination, and in particular in our minority communities. So I remain optimistic looking at it holistically for the coming months.
Nikki Zizaza with News 6. This question's for Dr. Pino. Dr. Pino, earlier you made some comments about the Delta variant and how it has not been reported here in Orange County. However, there's so many people, especially after, federal health officials announced that it's now a variant of concern. So, as we're going into the fall and as there's more talks about flu season coming up and we may have to mask up again because we're not sure what's going to happen, what measures, if any, can residents of Orange County take if they're being told, hey, if you get the variant, even if you have you're vaccinated, you could still
Yeah,
get
so there is not a mandate for the mask, but it doesn't mean that people don't have the freedom of choosing to wear a mask. And I think you are going to see people to continue to wear a mask even if they are vaccinated. I think that how slow this past flu season has been is an indication how effective those masks can be for flu, even probably more than for others. So flu is a significant disease, it's not a one to play with. More than 30,000 people die of flu every year in our country. So it's a significant disease. Now, with the variants, the concerns that we have is that with this one, every time, and people may be getting tired of hearing these variants, but every time that they come, they are more transmissible than the prior. And that's a significant concern. As you mentioned, winter is coming in a few months. People will go back home, inside the homes, especially in the Northeast and areas that are cooler than Florida. People will, go back home and go into congregating settings. We are also concerned about seniors in congregated settings, and we are going to protect them. And although our numbers continue to be very, very low, and of the number of deaths that we have had reported to you today, none was from an assisted living facility. It is important also to continue to protect seniors, not just the young people. But with those percentages that you were mentioning being so low, that is our concern, that something like that could come and then quickly spread. And our population being below 18 is significant. It's over 100,000 kids. Our school system has itself, just the public health, the public school system has more than 200,000 students. So it's a significant number of individuals that need to be protected. And that percentage, as you said before, is only at 29.
Questions for both Mayor Demings and Dr. Pino. It's Brian Gillespie at the Orlando Sentinel. Up in Seminole County, they're getting ready to close their permanent vaccination sites at Oviedo Mall and at one of their libraries, basically letting the private sector take the lead now. Division of Emergency Management's 2 weeks or so out from stopping their mobile sites. How long do you anticipate Orange County being in the business of vaccinations or vaccinating residents county-run?
In terms of the public policy from an Orange County government perspective, we will likely be providing vaccination and testing for several more months.
Yeah, that is great. I couldn't agree more with that. But also don't forget that Orange County is a hub, and we only now vaccinated about 25 to 30% of the people that we vaccinate daily, even at Barnett Park, are not Orange County residents. And that is not to say that they shouldn't. More than welcome. We vaccinate anyone. But it is also important to know that our services serve as a hub for the entire Central Florida region.
And we're doing some, I think, innovative types of things. Dr. Pino, I'm going to ask him to talk a little bit about the airport and the vaccinations that are being done for those who are arriving into our airport and how that's going, if you can perhaps share with them, Dr. Pino.
Yeah, we have, the state is holding right now a contractor in place at the airport. We are planning to have another one. If that doesn't happen, the health department will assume that responsibility of providing vaccines at the airport. They move it a little bit to from 11 in the morning to 7 p.m., I believe, because the arrivals of the flights, so to make coincide our opening times with the larger number of arrival. And I understand that people have been waiting for an hour in line, and there is a line formed before they open. Our department went there and saw the setting. It's quite interesting the way they set it up, so more likely we will keep the same location, the same setting, and providing the same vaccines. We are going to use the resources that we have if we cannot have a contractor, because we think also, again, because this place being a destination, being a hub, it's important to vaccinate anyone who comes into the county to enjoy our recreational facilities and a good time. At the same time, we are protecting our residents by protecting those who are visiting.
All right. Thank you, Dr. Pino. All right. I think we have answered most of the questions. Again, we hope that as the weekend approaches this Saturday, we'll be recognizing the Juneteenth holiday. Hopefully you'll get the opportunity to attend some of the events where there'll be some educational opportunities surrounding them, and we have some initiatives that we will have underway. You'll receive additional information from our communications team here within Orange County. The next press briefing is scheduled for a week from today, which will